Hi, my name is Dr. Stephanie Ajadi, and today I'm going to talk to you about our balance program here at Reddy Care Physical Therapy. We have a lot of cool technology that helps us help our patients achieve their goals in terms of balance and prevent falls. At the beginning of this video, I'm just going to go over some of the things that may cause balance dysfunction. So first off is living a sedentary lifestyle and weakness in your muscles. So we definitely put through all our patients who come in with balance deficits through a strengthening program that focuses on the hips, the core, and building up their stability. Next off is lack of proprioception. So if you lack proprioceptive cues in your feet and in your hips as well, what happens is that you have difficulty standing on unstable surfaces. And that's what we use these foam RX pads for. And the last thing is our vestibular system. We do have vestibular specialists here that work with inner ear dysfunctions. So just showing you a few exercises that we do. We have hurdles here. So if anyone has difficulty stepping over objects, we practice that sideways, backwards. You could also do it forward. You could put these RX pads between the hurdles, so have them stand on this and step forward or step back onto an RX pad. So those are some good exercises. These hurdles also increase in height. So if you have difficulty stepping over a higher surface, you can raise that as well and practice. On the RX pad, we have people stand, our patients stand with feet together, eyes closed, and then you could do something with one foot in front of the other and have them practice the balance like that. Have like a balloon toss, a ball toss, reaching for cones, stepping onto objects to work dynamic exercises. Another complaint that we get a lot from our patients with balance deficits is stepping onto a curb. So when you're transitioning from a walker to a cane or a cane to no assisted device at all, it's very fearful walking outside and stepping onto curbs. So we practice that with stepping up, holding the balance there, no hands. We can also take our patients outside and practice on the curb outside our office as well to get some real life situations in. Another great piece of equipment that we have that helps with balance is the Techno Body Balance Machine. So as you can see here, you can do it on a static or a dynamic surface. So when I press this dynamic surface, you see that this surface down here loosens up and it actually moves. And that challenges the patients a little more rather than the static surface where it does not move at all. There's no give there. So that's one of the ways that we incorporate dynamic surfaces and work proprioception in our office. And there are various games that we could play here. So you could play Fruit Ninja, go skiing. There's a shooting range, you can fly a plane. So I'll show you one of the games. So right now it's on a dynamic surface, and we'll go skiing. Okay, so that's one of the fun things you could do with this machine. If you go back, there are also different kinds of training methods incorporated into this. So there are different lines that you could trace and work different ranges of motion. So for example, getting diagonals, which is not often worked in the clinic and kind of difficult to work on the ground. So have a patient stand on this, on a dynamic or static surface. And have them work in a diagonal. So some other great pieces of equipment that we have is our solo step system. So let me show you that. With this system, you can put on a harness like this and get it hooked up. And it locks in like that. Have the patient hook themselves in. And obviously we'll have a staff member doing this for the patient. And with this, our clinical staff will be much more confident walking with patients because it's much harder obviously it's actually impossible for a patient to fall in here. So things that we typically won't do with patients who are at fall risk, we can do in here more safely because they can't fall. So as you can see, impossible. If they do lose their balance, this will hold them up. So just some of the equipment we have. If you have any questions, feel free to give us a call.